In the 10 days since the massacre at Uvalde, there have been 20 mass shootings in America, leaving the country feeling numb after suffering from collective trauma over and over and over again. And I'm really concerned about the next generation who can't feel safe in the doctor's office, at the grocery store, movie theater, school, anywhere in public. Martin Luther King Jr.'s 14-year-old granddaughter, Yolanda Renee King, wrote an op-ed urging adults to imagine going to school every single day, wondering whether you and your classmates are next. Quote, "The fear, anxiety, and frustration are overwhelming. We can't just be kids anymore. Every loud noise in the hallway, every outburst is a reminder that our hopes and dreams can be snatched away by a bullet." And joining me now is Dr. Sue Varma. She's a psychiatry assistant professor at the NYU Langone Medical Center. Thank you so much for being here, doctor. Really wanted to have this conversation all week.
Absolutely. Thank you for having me.
So, during the pandemic and certainly in the last couple of weeks, I feel like we have normalized mass death, right? We just sort of don't blink an eye at it. We didn't really blink an eye at 1 million Americans dead from COVID-19 in just a couple of years. Mass shootings are happening over and over and over again every single day. I mean, how did we get to this point where we're essentially going numb every time there's a tragedy?
Absolutely. Psychic numbing, as we call it, or compassion fatigue sometimes, implies that we are so overloaded by living in a state of constant threat. Our brains were not evolved to handle this, right? We have circumscribed threat where we have one situation and our brain can wrap around, okay, what do I need to do? How can I mobilize my psychological resources, economic, financial? But we're not meant to be living in constant threat, not only for the last 2 years because of a pandemic, but because of war, inflation, and gun shootings, as you have mentioned, that have been going on for decades at this point and are only getting worse and are only getting more frequent.
So at the beginning of the pandemic, I remember talking to a scientist about how we essentially were diverting to lizard brain. Is that what you mean? Essentially, we're in fight or flight, but all the time. And then we're not really supposed to be in fight or flight all the time. And it's having, real repercussions out in society because people are behaving erratically and violently as a result of being in lizard brain, for lack of a better term.
So the lizard brain or reptilian brain is referring to sort of our more primitive brain functions, but our cortex, which is responsible for executive functioning, planning, strategizing, abstract thinking, language, a lot of really wonderful things, memory, concentration, and all of that is being compromised. Our sense of self, our well-being, our psychological safety is being compromised. When a child or an adult has to constantly think, I may leave the house and I may not come back home. And that is a daily reality. We're living in a war zone. And that's what we really have to understand is that when people have access to war weapons, we are living in a war zone. And that was never something that I thought would be a part of our reality living in the United States.
One of the things I want to pivot to is what we can do about it. I mean, how do we fix this problem now that we've laid it out here and we understand that, it's not, we don't want to be like this. It's our brains are doing a thing because of science. So what can we actually do on a day-to-day basis so that we're in a healthy way processing the trauma that's around us, but also learning how to cope as we move from, unfortunately, mass shooting to more COVID surges?
Yes. So we never want to become numb. And part of that is taking care of ourselves and getting mental health treatment if we need it. The unfortunate thing is that in some states, as we know, Texas ranks last with access to mental health treatment and also has the highest number of uninsured folks living there. So that's a problem. But if you are lucky enough to have access to mental health treatment, this would be an excellent time to utilize it. Turning the back of your insurance card, looking for the behavioral health line, and seeking a therapist. The good thing is that what came out of the pandemic is that more Americans have access to telehealth care. So even if you are living in a part of the state or country that doesn't have as many resources, and look, we definitely are at a shortage of it, but at least you can be in touch with a therapist. Then I would say is action. Action is a big part of moving forward and healing. And, in whatever way we have to be loud, we have to get together, we have to make noise about this, because as a physician, gun safety is absolutely part of what we do as part of our intakes with folks. And at the same time, I'm happy that the conversation is increasing including mental health. We do not want the conversation to get lost there because, as we saw, Texas governors cutting funding, $211 million with mental health funding, but saying that it's a mental health problem. So we can't do that. One thing that I was happy to learn was that Texas was trying to put in place, and has in some regions, a prevention. So prevention with mental illness and gun violence are going to be really big part of this. And meditation, breathing, connecting with folks, and taking care of yourself in whatever way is possible for you.
I want everybody to go to therapy. I am big proponent of therapy, destigmatize the idea of going to therapy. Therapy is like exercise, but for your mental health. Just think of it that way. It's just maintenance. Dr. Sue Varma, thank you so much for being here. It's a really important conversation. I'm grateful to you for having it. Please stay safe. Hi, I'm Zerlina Maxwell. Thanks for checking out our channel on YouTube. You can see more from Zerlina by clicking any of the videos on this screen, and make sure you subscribe below to stay up to date on the day's biggest stories. Thanks for watching.